Circling. There we go. Hello, humans. Happy Friday. Dr. Sarah Happening here with Performances Happening. And we are continuing our Total Worker Health Symposium interview series. And I'm so excited because today we have one of our keynote speakers, Dr. Christian Rathke. Welcome.
Thank you. I'm super happy to be here. I'm looking forward to our conversation.
We are so happy to have you. So this is a really long bio, guys, but get excited because I'm so pumped to be able to interview Captain Christian Rathke today. Okay. Captain Christian Rathke was commissioned in December 2011 in the United States Public Health Services after 7 years of service in the U.S. Navy. He earned a Bachelor of Science in Biology from Bridgewater College in Virginia, a Master of Medical Science in Physician Assistant Studies from the Yale School of Medicine, and a Doctor of Medical Science from the University of Lynchburg, where his work was focused on administrative medicine and organizational interventions to improve workforce health outcomes. Christian began his medical career as a National Health Service Corps scholar and medical provider, serving as a site director of a newly established community health center in Fredonia, Arizona. As the town's only full-time doctor, he treated all aspects of healthcare and served as a primary consultant to the mayor on public health concerns. His leadership extended into the community when he was elected president of the local Chamber of Commerce. He went on to specialize in cardiology for 5 years at Pensacola Naval Hospital in Florida, where he chaired the hospital's CHF Practice Guidelines Committee. Christian is also an aerospace physiologist, dive medical officer, and educator. We're not even done, guys. I know this is so exciting. Okay. Having trained more than 3,000 pilots and aircrew, including the Blue Angels and NASA astronauts. I grew up in Canada and we even saw the Blue Angels up there. So very exciting. Okay. In all aspects of human performance in high-risk operational environments. As a subject matter expert in flight physiology and hypoxia, he served 2 years as an instructor for the U.S. Navy Flight Surgeon Program, as well as a researcher and instructor for the Army Air Warrior Program. Trained in public health crisis management, he is deployed with a USPHS to respond to major public health emergencies. As a USPHS officer, his assignments have been with the National Oceanic and Atmospheric Administration, which I will now refer to as NOAA. Most recently, he served as the Director of Office of Health Services within the Office of Marine and Aviation Operations, overseeing 5 major medical programs: aviation medicine, behavioral health, dive medicine, marine medicine, and NOAA Corps medical affairs. He also served as a COVID-19 response medical lead for the Department of Commerce and NOAA for 2.5 years. Since May 2022, he has been the Director of Total Worker Health and NOAA's National Environmental Satellite Data and Information Services, where he leads a comprehensive organizational approach to workforce support, healthy work design, and a health in all policies framework that spans multiple federal sectors. He is also a distinguished fellow of the American Academy of Physician Assistants, a fellow of the Academy of Physician Assistants in Psychiatry, and a member of the American College of Healthcare Executives. Holy schmoly, that is very impressive bio and resume. Thank you so much for being here.
Thank you, Sarah.
Okay, so we can see why he was selected to be our keynote speaker. And in addition to he's doing 2 sessions at the symposium, a case study as well as a keynote. So can you give us a quick snapshot of what each one covers and how they connect?
Yeah. Well, thank you for that, Sarah. Thank you for the introduction. Really happy to be here, and so happy you're featuring speakers for this conference. Really excited about this conference, and hopefully seeing everybody in person in the DC area at the NIH campus. So I'm really excited because these 2 talks that I'll be giving during the conference really tell a complete story. The case study, one of the talks is a case study of the program that we designed here within NESDIS at NOAA. And the case study dives into how we built a comprehensive total worker health program inside of our organization, showing what it takes to move from a theory from theory into real organizational practice. It's about the nuts and bolts, how we design systems, measure burnout, redesign work itself, so healthy work becomes the default. The keynote that I'll be giving really zooms out more on the global stage, making the case for work itself as a primary or one of the primary social determinants of health. In other words, the way we design jobs has as much influence on health outcomes as things like housing or education. Together, these two talks really move from how we did it to why it matters to all of us.
I love that. And what I'm hearing, you're my sixth interview now. And I love how everybody is bringing up this more holistic view of how humans perform at their best and how we can support health. It's not, like you said, it's a comprehensive view of we're humans. So there's more than one little thing that's going to affect our health. And what I did hear, what I'm personally very curious, is you said you measure burnout. What tool do you use? Do you do a survey or assessments, or how is burnout measured in what you are doing right now?
Yeah, great question. So there are a number of instruments out there that are validated tools if you look or span research on how to measure burnout. Probably the most validated field tested tool is the Maslach Burnout Inventory. And what we did is we took that survey and converted it to a Google form, and we deployed that across our organization as a pilot study, not just for our federal employees, but for our contractors at all, and everyone that contributed to a team, to the workforce as a whole. And so we used that to really measure burnout within our organization. And then that gives us a benchmark then to tell whether or not the interventions that we created with the research that we did, follow-on research after measuring burnout, were actually effective.
Yeah, I love that. Because if you don't measure something, how do you know if it's improving? And the human condition is to forget. I always say this example. I do personal training. I've been doing personal training for decades now. And when I first put someone on a Bosu ball, they can't stand. Like, they're shaking. And then within a few weeks, they're balancing on one foot on a Bosu ball, and they don't remember that they couldn't stand on it with 2 feet. So it's the human condition. So it's really always great to be able to pull in that data and the science to say, look, here's our intervention and here's how it's actually working or not working. But in most cases, when you're tackling burnout, we always hope that works. Okay. In your case study, you show how NESDIS built a comprehensive total worker health program. What makes this approach different from the way most organizations think about workplace health?
Yeah, thanks for that question, Sarah. I like that question. Most organizations start with individual level programs. And what I mean by that is fitness challenges, stress apps, or even employee assistance programs and so forth. But those things are really focused on the individual. Those can help, and they're important for people that are in crisis, but they don't get at the root causes of work stress or burnout, for example. Our approach flips that model. Our program is 80% focus on upstream efforts. In other words, policies, leadership, practices, work design, organizational systems, and only 20% of what we do in our total worker health program is focused on individual resources. So that shift is what makes the program, one of the aspects that makes the program comprehensive. We touch on every part of the organization. Now, that's not program sprawl, so to speak, but instead it's enabling workforce health and embedding workforce health into strategy, budgets, tactical decision making, everyday decisions. This lesson, or the lesson is, and the point of the case study specifically, is really that the most sustainable results come when an organization takes responsibility for making work healthy, not just the individual. Oftentimes employees were telling us when we started this program 3 years ago that they were really tired of the workforce coming to them and saying, hey, take this resilience class, take this class about how you can, better be more resilient for this, that, or the other. The workforce essentially was telling us that what that sounds like to them is, hey, fix yourself before you come to work, versus the organization taking responsibility for the change that really needs to happen, transformative change. So when it comes to, you mentioned burnout and some interest in burnout and how we measured burnout. Well, on burnout specifically, no amount of counseling or education or awareness training on the topic of burnout is going to fix the individual if we're only going to turn around and put them right back in the environment that was driving burnout in the first place. And so that's really what total worker health and this comprehensive approach and this upstream systems level approach is about. And that's what this case study that I'll be presenting on really dives deeper into.
Yeah. I love that. It sounds like you're helping to create a culture that's supporting like holistic well-being versus you need that. And we can't overguess what people need unless they tell us. And what I really love is when you are creating that culture and it's starting with leadership and within the organization, what it does is create a safe space for then the individual to say, okay, well, here is what I need, or this is available. I love that. It's more of that cultural shift versus helping the individual, because yes, we need to help the individual as well, but I think it's easier than to support a whole organization. So I love that. Nice work.
Cool. Thanks.
Okay, you piloted tools like the NASA TLX and a burnout study to capture workload in real time. What did those efforts reveal that surprised you the most?
Yeah, well, the surprise was not just in how high our numbers were. We see this national trend, even pre-pandemic, across the United States, both in the public and private sectors. We've seen burnout numbers in multiple research studies start to climb up and increase really over the last decade and a half. We've just seen a steady incline of burnout within the workforce as a whole. But what we were surprised about were the patterns that we documented. So we utilized the NASA TLX, which is it's been around for a long time, but we used it very uniquely in the way we deployed it, and a couple of extra questions that we added to it to get to the causal factors of what was driving people's work. And what we saw, for instance, that overtime hours and sick leave actually move together within our organization, which means when people push harder at work, they often pay for it with their health. And so with the NASA TLX, when we mapped workload drivers across tasks, we could actually forecast burnout risk before they showed up in absenteeism and turnover. What's exciting is that it wasn't just data for the data's sake. We turned those insights into redesigned meeting practices, staffing adjustments, and smarter task building for our employees. It showed us that measuring workload in real time isn't just possible, it's actionable.
I love that. That's exciting. So if you were to give another organization a piece of advice of when they're tackling burnout from an organizational perspective of top down, what piece of advice would you give them? Where's a good place to start with all this?
So first I would use a validated tool, whether it's Maslach burnout inventory or a different tool, but Maslach burnout inventory is a very, very short questionnaire. Deploy that, really encourage participation in that. You can do it anonymously. We were able to gather all that data anonymously, which workforce is much more likely to participate in. So measure the problem. That's the first thing. And then the second thing, don't look to awareness campaigns or classes or teachings to fix your problem. The problem is the workforce. The problem is the way work is designed. It's the way you set up your work. It's the excessive meetings. It's the it's the organization's fault that the person's burned out. It's not the individual's fault that they're burned out. And so don't even start the journey unless an organization's willing to accept the responsibility for the findings. But if they are, then you're at a good spot, and you're at a spot where leadership then is ready to transform the organization and redesign whatever aspect of work needs to be redesigned to decrease burnout.
Beautiful. I'm going to ask a selfish question, because I help companies with burnout as well. But how do you get the buy-in from the people at the top? Because as you're saying, it's not an individual problem. It's the way that the organization is creating the work for the humans. Do you have any advice for me for how to get that buy-in?
Yeah, so I definitely touched on this, both in the keynote, but definitely in the case study workshop that I'll be giving. So I'm just processing the best way to answer this for you. Partially, it's the way you set up your program in the first place. It's very hard for an outside consultant to come in and fix something like burnout for an organization, because it truly is a process that takes a long time. It's not a stop and end process. It's a true transformation in the way work is conducted in the organization. The way we designed our total worker health program 3 years ago, and one of the distinctive aspects of it, it makes it so unique, particularly in the public sector, is that we designed it to influence and change the organization at points of decision. So I sit as a fellow executive with all the other executives, and I'm involved in all strategic, tactical, and budgetary decision-making operationally at the time of decision-making. So I bring in that human factors piece and consideration while we're making decisions, and as we design policies, and as we create processes, and as we lay out what the objectives are for the organization. That's a really, really important aspect, because now I'm talking as a peer with my fellow executive peers, and invited into that decision-making process on a daily basis. And so that's one aspect. The other aspect is trust. Trust is key, and it's trust at every level vertically within the organization is key if you want to transform an organization at a systems level, at the executive, at the manager, supervisor level, and at the frontline employee level. Trust has to be there to truly adopt a new systems change. And that's really what we're talking about, is a systems change when you're redesigning work. And the more complex your work environment is, the system of work is, the more likely you are to get resistance at different levels in the organization. But resistance needs to be looked at as a positive. That means that you're dealing with a complex system, and complex systems, as you change the system, is going to kick back. And that should be an indicator that, okay, that's not going to work. Or if employees are looking for workarounds in this new system you've designed, that means the system isn't working. So there's a positive feedbacks from a total worker health or work design standpoint that you need to adjust the system so it works, it's practical, for the people that have to live within that system day to day, but yet achieves the outcomes, the measurable outcomes, in this case, reduced burnout that you're trying to achieve.
Yeah, I love that. I hear again that big cultural shift, and it is within the organization, and it takes a lot of time. These things don't happen overnight. There's no magic wand, and it is a slow, and I heard you say we're measuring, like you're trying something and measuring and seeing if it's working, and resistance can be good because humans don't want change. We don't want success. Our brains want to keep us safe and not dying. So if there is resistance, often it means that you're doing something different, and we have to work through that resistance to get the results that we want, right?
Yep.
Okay,
Right
let's
on.
talk about a very popular topic, AI. So toxic work cultures, AI disruption, which I'm sure is happening in every industry, and then burnout again. Which do you think organizations are most unprepared for?
Well, you've done such a great job at already touching on the topic. Honestly, I think it's culture. And so we talk a lot about technology and economics, but culture is the quiet killer. Toxic workplaces, harassment, and lack of trust create these ripple effects, like more health claims, lower engagement, employee engagement, and higher turnover, employee turnover within an organization. And the irony is you can implement the best tools and best practices, no matter how much science I'm using to create the absolute best system, so to speak. But if the culture is unhealthy, they won't stick. Burnout and AI, of course, are huge, but they're easier to see. Culture is harder to see. It's invisible, in fact, until it's already hurting people. That's why supervisors and leaders matter so much within the organization. They set the daily climate. In fact, first line supervisors account for approximately 70% of an employee's engagement and have the greatest influence on employee retention. So if we don't get culture right, none of the other solutions will reach their full potential.
Yeah. I love how you said culture is invisible. It sure is. And it's one of those things. So my background is in sports and exercise psychology. And there's this saying, someone mentioned it to me, and it's always stuck in your brain, is it's one of those things like body odor. By the time you smell your body odor, it's a little bit too late. But like your teammates might be smelling it and all that stuff. So I think that it's a good metaphor of like culture. Like you're in it, you don't realize that it's too late until you hit burnout. And a lot of people don't know that they're in burnout until they can't function properly and they don't realize what's happening and that it's not their fault. It's their organization's fault.
Yeah, and another, I like the way you characterize, people don't know that they're in burnout until they're really deep into it. And I think that lends it, at least from the way we think of it from a medical aspect. Burnout is a spectrum. And so it's not on or off. You're not burnout or not burnout. There's a true spectrum of what burnout is. And people that reach a certain threshold of burnout, it takes a long time to recover, months to recover from true burnout, which is very different than stress. A weekend away, a week vacation can alleviate stress. It doesn't alleviate burnout. The second you walk back in the front door at work, you're just as burnout as you were before. And so burnout has a much longer recovery process relative to work stress.
Yeah. A lot of what I do is I work with neurodiversity, especially ADHDers. And with us, a big part of the masking, they get to a point in the burnout recovery for them, as you said, can be months, but extra special for neurodiverse brain. But because a lot of them don't even realize that they're neurodiverse and they've been masking for so much of their life. And then with a lot of autistic humans and ADHD humans, they can't function at all anymore because they didn't even realize they were masking. And then they have no energy and resources to be able to even put this mask on of performing and showing up and waking, and it's just such an interesting phenomenon that happens. But I think it's amazing that you're taking this comprehensive approach and looking at it from the top down, because it is within the organization that these problems are carrying. And like you said, you can go on vacation and come back, and if nothing happens at work, your environment's still the same. Nothing, you go back exactly to being burnt out again. So I love what you're doing. I think it's absolutely phenomenal. I have one more last question because I know we're going over time. You've led trainings in some of the most high pressure environments, from aviation to space flight. What lessons about human performance in those extreme settings could everyday workplaces learn from?
Just processing here. I would say the takeaway I would want people to understand about work is that work is a primary social determinant of health. In other words, they're the non-medical things that have real tangible health outcomes. How long we live, what our quality of life is like, what kind of mental health we have, physical health we have, all tie into work. But I think I really want people to know that healthy work and job quality are not optional. They are the engine of resilience, innovation, mission success. When we design work well, we don't just protect people, we unlock performance, creativity, and even at a national level, national competitiveness. So my message is really simple. Treat work design as a lever for all aspects of health. Don't regulate it to wellness perks or add-ons in the workforce or a compliance checklist. When organizations take ownership of making work healthy by design, everyone benefits: workers, leaders, society as a whole.
I love that. And we spend so much time of our lives at work, and we are humans. So we bring that to the rest of our lives. And if you can be in an organization where you feel supported and there are interventions for you and they actually care about their humans, I love that. And it sounds like that's exactly what you're doing. So keep up the good work. That is so great. And can you tell our listeners, I have it written down here if you need it, but your case study and your keynote, and that I just want to say that you can still register for the conference. We have virtual and in-person options, and you can just go to the Total Worker Health Symposium website to pick those up. Okay. Yes. Let us know about your 2 topics that you'll be talking about.
Yep. Well, we sort of touched on both of those. The 2 topics, one is a case study, which is a 75-minute basically workshop, which is a deep dive of the way we've designed and the way we implemented this program. All the research that we've done, I'll be reviewing all of that. And the resources associated with that are really designed to help a person or help an organization design a program for themselves. So it's a very comprehensive deep dive of how we've designed and implemented, how we've interpreted and synthesized all the science, and then condensed that into an implemented comprehensive program. The keynote is much broader and really looks to inspire the future, the next decade of total worker health from an implementer's point of view, which is very different than a researcher or an educator's point of view. So from the person who's in the trenches, what do they see the next decade as? And then that's followed on by where I'll be moderating a panel of individuals that in different industries that have implemented total worker health in a successful way that's created measurable change within their organization.
I love
So
that.
I hope everyone comes. I hope you sign up. And if you come in person, feel free to tap me on the shoulder or the elbow, and I would love to meet you in person, and certainly share whatever resources we have with you as well.
That's awesome. Well, I know I'm going to be at your sessions. They sound so exciting and very helpful to the humans that are actually working in wellness in different organizations. And I would love for you guys to join my session, which is going to be on Thursday, the 23rd at 11:15 in room F1. It's called Move at Work Challenge, Driving Employee Happiness and Health. Thanks for joining us today, and we will catch you in the next interview series and hopefully to see you in Bethesda. Okay, bye guys.
Yeah.
And